Correct. Welcome to Omni Health Insights, your one-stop resource on all the latest developments transforming the healthcare industry. In discussion today is clinical hypnotherapy and its prevalence in the region. Joining us is clinical hypnotherapist Peta Cavanagh. Welcome.
Thank you for having me, Fatima.
Thank you. So, my first question is there an emergence of clinical hypnotherapy in the UAE? And how are patients receiving this? Are they more receptive? Do they have some questions? What has the overall experience been like?
So I think since the DHA strategy, Happy Lives, Healthy Communities, was released in 2006, and just to be a little bit clear, that was released to remove the stigma around mental health in the UAE. I do believe that there is much more acceptance of seeking support for mental health issues, and in turn, that means more acceptance of hypnotherapy within the UAE. So just to give you some clarity on that, according to WHO, the UAE has the highest level of depression in the region. So at just over 5% of the population, the country also ranks very, very high for anxiety. So we're looking at well over 4% of people suffering anxiety. So it's really important that people do have support. But there are a few reasons why hypnotherapy in particular has become more popular in the UAE. One of those reasons is that there is a very, very long waiting list for psychologists and psychiatrists. So, we're talking anywhere between 3 months and 6 months waiting. And if people are suffering from mental health issues, that is just enormous wait period. So people are starting to think outside of their normal choices, and hypnotherapy comes under that banner. So that's been, amazing for my clients and amazing for the industry as well. And also there's another reason. So I think almost 90% of the population in the UAE are expats. And hypnotherapy is quite common in different regions around the world. So, when you're looking at India, the US, Europe, Australia, it actually makes sense that these expats are searching for the support that they can get in their home countries. So that's another reason. But in my experience, it's actually quite popular within the Emirati community as well. So that's been really, really good.
I think such an important thing that you raised is that more awareness about mental health and kind of removing the stigma surrounding it. And how does clinical hypnotherapy really act as an ally in that sense? And how does it differentiate between hypnotherapy and clinical hypnotherapy?
Okay, so the difference between clinical hypnotherapy and hypnotherapy, clinical hypnotherapy refers to a more holistic approach. So for me in particular, I don't just treat the symptoms. I actually work with my clients to uncover the source of the problem. So for example, many clients come to see me under the umbrella of, say, anxiety or chronic pain or weight loss. So of course I treat these presenting symptoms, but these issues are the top layer. So I rarely see clients just for one session. I do, but I discourage it a little bit. I would highly recommend that I see my clients at least 3 times. So when I do that, I can do a full intake in the very first session. So I'll spend a really long time getting to know them, getting to know, everything about them, their triggers, and really start to delve into what the actual problem is. And then in the second and third sessions, we go deeper. So we uncover the real reasons that people are suffering, remove any of those emotional blocks, any of the attachments to the trauma, and anything that their subconscious is hanging on to. So I think for me, the clinical hypnotherapy part is, a holistic view. So, and just to answer your other question, is it an important ally in supporting mental health? So clinical hypnotherapy works very closely with traditional therapy, and I believe it's a very important ally, and I believe they work very, very well together. So, for example, psychologists and counsellors work more with CBT, or cognitive behavioral therapy, and hypnotherapists work more with the subconscious mind. So granted, some psychologists do use hypnotherapy, and some hypnotherapists like myself use CBT, but I do have a lot of psychologists who recommend my services, and then I recommend psychologist services at the same time. I have a lot of clients that work within that realm of using both psychologists and hypnotherapists, and it actually works really well. The other thing is I have surgeons who recommend hypnotherapy. So, for example, I did have a client recently who was suffering terribly from migraines. Now, she had done every possible examination with her neurologist that she could, MRIs, absolutely everything, and nothing was showing up. So he recommended that she do hypnotherapy because obviously she's, her subconscious is hanging on to this pain for some reason. So in that sense, hypnotherapists do work with, with the mainstream health practitioners. I recently had a client who was suffering from severe chest pains. He had had heart surgery recently, but he was completely recovered. So his cardiologist recommended that he do hypnotherapy. And I guess this is the holistic view that I was talking about before. So, a surgeon will ensure that you're completely healthy physically, but it can be difficult for the person to make that mental leap to recovery. So this is where hypnotherapy comes in. If I can give you another example, things like often family doctors will recommend hypnotherapists. So things like weight loss, smoking, things like that, a family doctor may recommend a hypnotherapist. I have a program that I use for clients who are contemplating having gastric band surgery. So this surgery is very common in the UAE. So a doctor will refer their client to me to do what I call, the program is called a virtual gastric band. But this basically instructs your mind that you have had that surgery. So it's just, the mind is so powerful, how quickly your body reacts. But yeah, to answer your question, we work together, which is fabulous.
And I think that's such an important point you raised right now, that the mind and the body work together. And oftentimes they kind of, there's a cross where, if you're not feeling well mentally, it might have a physical impact. Or if you're not physically feeling well, you might have stress or anxiety. So how does therapy help patients feel better in both senses?
So, hypnotherapy will remove what your subconscious is hanging on to. So, often my clients will, So, for example, if there was, a trauma that they went through when they were younger and they haven't been able to move beyond that. So sometimes talk therapy is great. CBT is great, but sometimes you really need to go down and remove that from the subconscious. And the other thing is, it can be like when you're little, you're viewing things from the mental capacity of, say, a 4-year-old or a 5-year-old. So it maybe there's been no trauma, but you've deciphered it as something like that. So your subconscious is still holding on to that, and it's still putting you in that fight or flight mode. And so you're still feeling anxiety, even though, nothing happened, there's nothing wrong. So it's just about retraining your subconscious mind to, you don't need to put that person into fight or flight all the time. Things are okay. So, yeah.
And would you say that clinical hypnotherapy can be a standalone form of treatment, or does it usually work better hand in hand with, as you gave such great examples earlier, like, being advised by surgeons to, go in for clinical hypnotherapy, or working in hand with other treatments like psychotherapy?
It absolutely can work as a standalone treatment. I think, things like giving up smoking, yeah, absolutely. So I would say, 95% of my clients who want to give up smoking have achieved that just with hypnotherapy. That's kind of a really basic one as an example. The other thing is, I do work with children as well. And so if you're talking about, for example, a 6-year-old who's struggling to make friends at school, I don't believe they need to see a psychiatrist. And I think in some cases, and I think sometimes to walk into a hospital could be very daunting for a little one. So for this, hypnotherapy and mindfulness and bringing in a little bit of meditation for them as well to work on their self-esteem and self-confidence just makes so much difference to them. So I think standalone is fine.
I think I have a question which really I would like to understand. How does the process of the clinical therapy really go about? Because you just mentioned meditation. That's quite an interesting, part and process of it. So when a patient comes in, what kind of processes are in place, and how do you determine, if meditation will be a part of it?
So meditation is interesting because meditation is using your conscious mind. So you're consciously getting into that calm state, whereas hypnotherapy is using your subconscious mind. So the actual process is that obviously we'll talk to the clients and we'll work out which different modality is the best one moving forward. And then I have a really relaxing space and my clients just lie down, close their eyes. I tire out their conscious mind, and whether that's by counting or just by talking to them. And it's almost like, a guided visualization. So it's very, very relaxing, kind of like meditation, like a guided meditation. But then I take them down to a deeper level, and that's where we talk to the subconscious mind. So, my clients are awake the whole time, but they're very, very relaxed. So, yeah. And as far as the meditation goes, I do give them meditation as homework to do. And I think that just brings their, sometimes if their anxiety levels or what they're going through, it just brings their emotions down so that they can cope with daily stresses and what's happening. So I do the meditation for them as homework to take home, or any visualizations as well. And then they come back and then we work on, where they're at after that.
And just touching upon another thing that you had mentioned about how some patients come in for help with, maybe weight loss or trying to quit smoking. What other ailments do they usually come in with? We also discussed mental health, so that's quite a rising issue that a lot of individuals in the region are also facing. So can you talk a little bit about that as well?
Yeah, I mean, absolutely. So different ailments that people come to see me for. Definitely trauma, whether it's real or perceived from when they were younger. Absolutely, because I think that's very difficult. I'm seeing a lot of anxiety, just a lot of anxiety, particularly in teens. I think teens and children since COVID. So, doing this homeschooling, it was very it was detrimental to a lot of children's health, mental health. So I'm seeing a lot of teens and a lot of children who are struggling to get back to that normality. And the fear, I mean, as an adult, we were very afraid, but how does a child decipher that fear? And it's so there's been a lot of anxiety through that. Yeah, other things, stress definitely, and particularly exam stress for the teens trying to get into university. That's difficult. Addictions, including smoking, obviously. Confidence and self-esteem is big issues. Limiting beliefs, fears and phobias. Fears definitely. Even things like public speaking, grief, yeah, things like that.
Do you feel that these conditions that you just described are triggered because of the onset of COVID, since we've experienced COVID, or is it something that comes from a place where trauma has been experienced at a young age? It can be looked at in so many perspectives. So, what's your take on that?
I think when my teens are seeing me because they're suffering anxiety, because they don't want to go to school, because they're so used to being at home, that's definitely, due to COVID. And obviously in the UAE, we had people that knew people that lost their lives and things, people like that. So there's been a lot of anxiety related to COVID, yes, and a lot of fear in the children. Yeah. But as far as trauma from when they were younger, yeah, that's definitely completely different.
Definitely. And how do you see clinical hypnotherapy growing in the region? At this point, you mentioned that there's been a lot of patients coming in to speak to you about their stress, concerns, anxiety, myriad of ailments. So how do you see it progressing and becoming something that people are more open to receiving support from a clinical hypnotherapist?
Yeah, I mean, I absolutely see it progressing. Because even the fact that I am getting a lot of Emiratis to come and see me is fabulous. So I think I think the acceptance in the region is progressing, and I believe it will continue to do so. I mean, the more people that talk about it, then the more people understand. So.
Do you see a significant shift between how open people are to speaking about it now versus before?
I do. Yeah, I do. And like I said, I think, the government the DHA has absolutely helped with that. I think it was a necessity to make mental health more conversational and, more open to discussion. Yes. So definitely.
And just with adult patients, what are the kind of issues that they're facing at this moment? There is there's a lot of stress and anxiety, but there are also patients who suffer from other behavioral disorders, and just within the COVID situation and landscape, it's very challenging and difficult to kind of go on with your day-to-day lives.
Yeah, it absolutely is, and there's still a lot of people that are working from home. So I'm working with a lot of people who are suffering all sorts of different things. Post-traumatic stress is a big issue. ADHD, I help alleviate the symptoms of ADHD in adults and in children, and hypnotherapy is great with that. Hypnotherapy, like I say, combined with meditation, has some amazing results with that. And OCD as well. These issues, like, COVID has been very hard for people that are suffering with these issues. So even I have a few clients who are autistic or on the spectrum, and being stuck in the house, or very difficult. It's kind of made their symptoms a whole lot worse. So whilst things are starting to get back to normal, we're so grateful for that. But it has made some symptoms a lot worse for some people.
And how does clinical hypnotherapy step in to alleviate that when the symptoms have become so challenging for a lot of patients? How does it dismantle the fears, and how does it help cope with OCD, for example, or post-traumatic stress disorder? Those are quite heavy in all the kind of for patients to handle, I would assume so.
Yeah, I mean, as far as, patients with OCD or ADHD, the hypnotherapy, it calms them, so they can actually find their quiet, calm space. And we do the guided visualizations, and then they can do that at home, and they do. And so, that can just brings them to a level where they can find their own inner calm, which is great for them. For post-traumatic stress, I really look at delving into the subconscious and trying to remove it's to remove the connection of the subconscious with the event that happened. So it's about helping them to distance themselves and being able to view the event without it actually controlling their daily lives. So that helps with that.
Definitely sounds like a very integral part of well-being, mental well-being especially, more now than ever. So it's so good to hear that there's more open conversation and there are people who are more willing to come in and address these issues. So
Yes, definitely.
definitely.